afternoon, everybody. I think I'd like to start now. We've allowed a few minutes for people to come from lunch and so on. My name is Andre. I'm a GP in Ireland and I work with the Irish College of GPs and also with EQUIP, which is the WONCA Europe working group on quality and safety in general practice. And we're here to talk about sharing the skills to survive in a rapidly changing workplace, which is general practice. What country is there anybody here who's not experiencing a changing workplace within the health system? And it seems to be even more rapidly, whether it's systems, policies, payment structures, it's always changing. And I've tried to keep it simple, and I think in effect by the end of this workshop I think we could all be up here and I would like to be down there, because I think we have so much to learn. This is not a teaching session for me, this is a sharing of experience, a sharing of opinions, and I hope that when we finish this session in just under an hour that everybody in this room will have had something to add and something to contribute to this workshop. It's about sharing skills, sharing techniques, sharing knowledge that we might use to lessen the negative impact of work on us. And perhaps to think about, we won't be able to structure it in this short space of time, but to think about outlining a plan for our own personal self-care as we go forward in our career. My background, I qualified 26 years ago in Trinity. I'm a GP in the southeast of Ireland. I work with the Doctors' Health Programme with the ICGP, and I'm involved in a number of quality improvement activities with the college, and we're part of EQUIP Network, and Tina from Denmark is our president of EQUIP as well, so I'd like to introduce you to her. And Ulrich is our web manager, and he's doing a fine job recording the EQUIP activities at the conference. I'm also married and a mother of 4 daughters, 2 teenagers and 2 in primary school, so that's part of my work-life balance. And this website is something that I'm very passionate about. I'm passionate about our Gaelic sports, which is very much about team sports and team ladies sports and men's sports, in particular sports for the under 18s. And I've always been very active in promoting sport in our local community, and a few years ago I was a football manager in my spare time. So that kept me sane and kept me occupied and kept me not thinking about work after work. And I also like to do some gardening. So my special area of interest, quality improvement, particularly for GPs and generally in general practice, particularly patient self-management. And in the college, in the ICGP, we have set up a programme 13 years ago now to provide a system of confidential healthcare education and support. What's interesting about it is that it did not come from above, it was not a state scheme. This is something that came from the college, from college members articulating a need to do something about their health. The college responded and developed it. And I think it's a good model that you might like to take back to your own countries and to develop systems of support for other GPs. It is possible. If you and your colleagues want to do it, you can make a change. What's interesting about our model of care, is that it is based on primary care, on GP care in particular. And so many health supports for GPs and for doctors in general around the world involve assistance with managing addiction and psychiatry problems, as if that was the only area we needed assistance with. But primary care is, as we know, is key to managing the doctor's health care also. We have medical education section both for GP trainees and for CPD, and I've also been invited each year to give 1 lecture to some of the medical schools in Ireland as well. Interestingly, we now give lectures to first years in some of the medical schools in Ireland. Health services I'll talk about in a moment, and we have a telephone helpline where GPs can look for direction on how to manage their health issues or their concerns. We have a network of GPs, psychiatrists, counsellors and psychotherapists and occupational physicians, and all of the GPs in Ireland can contact these people without coming through the college. They can access the lists through the website and through the telephone helpline. We have also got links with EQUIP, the European Association for Quality and Patient Safety. We have had a working group on professional health, which generally provides workshops, interactive workshops at WONCA Europe conferences, and today at WONCA World. And I'd also like to draw your attention to this website, which is the European Association for Physician Health. It's a very new organisation. It was set up in Oslo in 2009. The founding members were the Norwegian Medical Association, the Galatea Foundation in Catalonia, the British Medical Association, Paracelsus University in Salzburg, and the Irish College of GPs. It's got free membership. It's essentially a forum for sharing information on services, education and research collaboration across Europe. We held our 4th conference in Ireland this year in April, and the proceedings of the conference are available on this website here, and they are being updated at present because some presenters wanted various elements to be retained and not to be displayed publicly just yet. So that is where you will find the proceedings of that conference. Membership is free. And the website we've got plans to develop the website, and the BMA hosts the website currently, but it will be moving to Barcelona, to the Galatea Foundation, and we have plans to develop the website further. It's just another forum for developing an interest in doctors' health and working together to improve the quality of healthcare for doctors. So, why are we talking about all of this? Well, there are many factors. Some of the factors that cause issues with doctors' health are the factors that actually cause us to self-select for medicine. They're the characteristics that we have of conscientiousness, perfectionism, hard work, and other factors that cause us to be here in the first place. And most of it is because we put the patients first. When we had a workshop recently in Dublin, and we were looking at the spelling of the word patient and the word doctor. There is no I in the word doctor. There's an I in patients. There's 2 O's in doctor. O is for others, and no O in patients. So we just thought that was a bit of fun to play around with. So that's what we bring to the training, our medical training, and the impact that training has on us. How many of you here have had medical education on self-care while you were in medical school? 1. Excellent. There's the evidence. Work hazards apply to everybody. They apply to our patients, but they also apply to us from the physical, chemical, biological area as well, but also from the psychological and social and human factor, invisible hazards. Our job is very heavily laden with these issues. Yes, we've got the biological hazards and physical assault and so on. However, these are the factors that we need a lot of assistance with, and a lot of self-care. Some of those hazards are the following. Some of us might never be impacted by some of these hazards, but some of us might have several different areas of hazards from time to time, or cumulatively all at the same time. And these are the hazards that have an impact on us. These are the hazards we're exposed to in the course of our work. I'd just like to share this slide with you. This is it's a summary of the output of a workshop that we did in Dublin a few months ago, which involved GPs and practice staff. And they were given some homework preparation to do before the workshop. And during the workshop, we worked on the tasks on trying to find the source of pressure and stress in their job, in their work, and then find a means to address them. So in the group, we divided them into job tasks. Now, each of these 4 areas can take an awful lot of input and a lot of teasing out and analysis. But from the job task, just for example, we looked at the stress of administration for doctors and staff, the stress of managing the practice, health and safety, supplies, replacing the light bulbs, keeping the place clean, human resources, which is managing the staff, sickness absence, skills, training and information, standards, including external standards that we must comply to at work, in order to have a business and practice, clinical care issues and keeping up to date with all of that. And then from the point of view of expectations and demands, we could talk for several hours, I'm sure, about this area and the impact of this on our lives. The expectations that patients and their families have, professional expectations from our professional organisations and our regulatory bodies, financial expectations, legal and medical legal expectations, and what expectations we impose on ourselves, which are often very profound. Our own personal expectations to be perfect, to be always perfect, to be the perfect doctor. And then balancing all of these work issues with non-work activities, our family, our friends, our hobbies, and the activities that we might have enjoyed perhaps in the distant past, and we're now people who used to do something that we enjoyed. And then we spend quite a bit of time on the time management of all of the above, and how that comes to play. So this is just leading me into the interactive bit, and this is where you take over completely, because what I want you to do is to reflect and share. And because it's a short workshop, I don't think we break into small groups and get someone to present from the groups. I think it would be nice after lunch just to talk freely from the floor. Think as long as you want to. If you want to share something, it would be very nice if you could share something on this question. What do you personally find useful to help you to overcome perhaps a specific source of stress, if you want to mention that, at your work, or what do you find useful to improve your overall level of job satisfaction? I've been painting a little bit of a negative picture. I now want to turn the table and make this a very positive outcome, so we can find positive things to take away with this and hopefully share with our colleagues in our own countries.